Cardiovascular System. The human cardiovascular system is an organ system that conveys blood through vessels to and from all parts of the body, carrying nutrients and oxygen to tissues and removing carbon dioxide and other waste. Hypertension is quite common disorder affecting many people who typically don't even notice any symptoms. Now, in order to gain a better understanding of pharmacology of antihypertensive drugs, first we need to review basic physiology of blood pressure. Blood pressure is simply a product of cardiac output and systemic vascular resistance. So when we talk about blood pressure, we generally refer to the force or tension of blood pressing against the artery walls. There are a couple of major systems involved in pressure regulation. First is the arterial blood pressure that is regulated by pressure-sensitive neurons called baroreceptors located in the aortic arc and carotid sinuses. So for example, when blood pressure falls too low, those baroreceptors can send signal to adrenal medulla, causing release of catecholamine and thus increase in sympathetic activity through activation of beta-1 receptors, causing increased heart rate and stroke volume. Thus increases cardiac output, which leads to increased blood pressure. On the other hand, activation of alpha-1 receptor on smooth muscle causes vasoconstriction and thus increases in vascular resistance, which again leads to increase in blood pressure. Now, another system involved in blood pressure regulation is the renin-angiotensin-aldosterone system. So we also have baroreceptors in the kidneys that respond to fall in blood pressure or reduction of blood flow by releasing enzyme called renin. Renin secretion is also stimulated by sympathetic activation of beta-1 receptors in the kidneys. Renin is necessary for the production of angiotensin-2. Angiotensin-2 is a very potent vasoconstrictor which constricts systemic blood vessels, thus increasing peripheral resistance. It also constricts renal blood vessels and stimulates aldosterone secretion, which leads to sodium and water retention, thereby increased blood volume, cardiac output, and ultimately increase in blood pressure. Now, let's switch gears and let's talk about the hypertensive agents that we have chosen in this activity.
In this presentation, we will discuss 3 different drugs under cardiovascular system. This includes Olmesartan medoxomil, an angiotensin receptor blocker, Felodipine, a Dihydropiridine-Calcium Channel Blocker, and Quinalapril, classified as Angiotensin-converting Enzyme inhibitor. We will first introduce Olmesartan medoxomil. This drug provides an effective antihypertensive property by selectively blocking angiotensin-2 type 1 receptor sites found in vascular smooth muscle, thereby inhibiting the vasoconstrictor effects of angiotensin-2. Here are the following dosing information that can help medical practitioner. 10 mg as its starting dose, 20 mg as its optimal dose, and the maximum dose is 40 mg. Improvement and advancement of Olmesartan medoxomil lead the drug to have an almost complete 24-hour blockade of renin-angiotensin system, which is more beneficial comparing to combined effects of angiotensin receptor blockers such as losartan and valsartan in recommended doses, plus angiotensin-converting enzyme inhibitor drugs. The effects of combined drugs may induce the risk of side effect of angiotensin-converting enzyme inhibitor such as dry cough. Furthermore, Olmesartan medoxomil shown to have a renoprotective and anti-sclerotic activity in patients with diabetes. Olmesartan as a drug is tolerable with low drug interactions and given once daily. In this comparison, the diastolic blood pressure showed significantly greater reductions with the use of Olmesartan medoxomil than losartan without advancement and improvements. At Europe recommended doses, Olmesartan has been shown to be more effective than other sartans at their respective recommended doses. Moreover, it decreased the overall cost of medical care for patients with uncontrollable hypertension. As a conclusion, Olmesartan medoxomil is an effective, fast-acting, and well-tolerated antihypertensive agent that can be administered once daily. At its recommended doses, it is significantly more effective at reducing blood pressure than several other agents of its class. Thus, Olmesartan medoxomil represents a good option for the initial intensive treatment of patients with hypertension. The second drug under cardiovascular system featuring Dihydropiridine-Calcium Channel Blocker drug, Felodipine, an orally administered drug. The therapeutic action of this drug is to lower high blood pressure, which may prevent strokes, heart attacks, and kidney problems by acting on the voltage-gated L-type calcium channel. It acts primarily on vascular smooth muscle cells by stabilizing voltage-gated L-type calcium channels in their inactive conformation by inhibiting the influx of calcium in the smooth muscle and thus prevents calcium-dependent contraction and vasoconstriction. Here are the different doses of this drug: 2.5 mg, 5 mg, and 10 mg. The PLGA or poly-D-L-lactic co-glycolic acid is a polymer of lactic and glycolic acids that is easily biodegradable and considered to be non-toxic, which enhance the bioavailability of felodipine by targeting the M cells or microfold cells of Peyer's patches. Felodipine exhibits poor bioavailability due to limited aqueous solubility and extensive first-pass metabolism. Nanoparticles which prepared using nanoprecipitation and optimized by 3-squared factorial designs. In this comparison, the PLGA particles were shown to enhance the bioavailability and improve safety of hydrophobic and enzymatic unstable drugs. It was shown that PLGA particles delivered using oral gavage promote sustained release in plasma, showed that encapsulating felodipine, a dihydropyridine-calcium channel blocker, used alone or in combination with other antihypertensives, into PLGA significantly improve its ability to control systolic blood pressure in salt-induced hypertension in rats. This was attributed to increased bioavailability of felodipine, which by itself has low water solubility resulting in poor bioavailability in standard formulations. In this study, we conclude that felodipine-loaded PLGA nanoparticles were formulated for oral delivery. Absorption through Peyer's patches bypasses liver and thus increases bioavailability. Nanoparticles were prepared by nanoprecipitation and optimized by 3-squared factorial design. Nanoparticles controlled blood pressure and ECG changes in rats for a period of 3 days. Nanoparticles can be an alternative to the current market therapy in hypertension and angina. Our last drug to be discussed is Quinalapril, an angiotensin-converting enzyme inhibitor. This drug is indicated in the treatment of hypertension and appears to confer special advantage in the treatment of patients with diabetes, slowing the development of diabetic glomerulopathy. This drug acts by inhibiting the activity of circulating angiotensin-converting enzymes, thereby reducing angiotensin II formation. The dosing information for this drug are: for initial, you can give 10 to 20 mg orally every day, or may administer 5 mg in patients receiving diuretic therapy if the diuretic is continued. And for maintenance, you can give 20 to 80 mg orally every day or divided every 12 hours. In the conclusion of the study for Quinalapril, it improves the insulin sensitivity more effectively than did Olmesartan in the genetic hypertensive rats with insulin resistance and relatively severe metabolic abnormalities. For more deep information about the drugs discussed, please check these links. Thank you for watching. Bye-bye!